What's that? I need a gavel. No. I'm good to go. Oh, thank you. All right. All right. Appreciate everybody being here on short notice. Shouldn't be a long meeting today. This is actually, there's two purposes for the meeting today. One is to kind of go through the, at least and primarily for the sake of the committee members, the budget work that we've done for DCF, KDHE, KDADS, and I also have the Office of Veteran Services for me. This is to get me ready in all candor. This is to get me ready for tomorrow and Friday. So if you like live entertainment, go to appropriations the next 2 days. So may not always be fun. Second thing, pardon? I might need chocolate. I might need a lot. Or something stronger. And then we also we have two things to, pardon me, some cleanup items, one in KDADS and one in DCF, but those we'll do after the updates of the agency. So with that, we're going to start with DCF, and I'm going to have Amanda kind of give a recap of what we did. Either way, if you want to do it at the podium, you don't have to. If you're comfortable right there, I'm good with it. Take it away, Amanda.
Yes, sir. So I'm Amanda from Legislative Research. We're going to discuss, as the chair said, what was changed or added for Department of Children and Families. So for fiscal year 2025, our starting point was the agency request. The agency submitted a revised estimate for 1.1 billion all funds, including 493.7 million state general fund in fiscal year 25. When the Special Committee on Legislative Budget met in November, December, that group chose to delete the remaining 23.8 million state general fund reappropriations and then add back funding for human services caseloads to adopt the fall human services caseload estimate for 25. And then last month, when the House Committee on Social Budget met, the Budget Committee concurred with the LBC's recommendation for 25 with the following adjustments. They added 3.7 million, including 1.8 million state general fund to administer the summer EBT program in fiscal year 25. They also added language to lapse any unspent money for administering the summer EBT program in 25. Chair and committee, are there any questions for 25? Yes, sir. Moving on to 26, the agency submitted 1 billion all funds, including 477 million SGF for fiscal year 26. They also submitted 12 enhancement requests totaling 9.7 million. Last November, December, when the Special Committee on Legislative Budget met, they did a global motion to delete all enhancement requests, so they deleted the 9.7 million. And then the Special Committee on Legislative Budget also chose to adopt the fall human service caseload estimate for fiscal year 26, which meant they deleted 14.1 million all funds, including 8.1 million state general fund and adding 400,000 for TNF cash assistance. Then in January, when the House Committee on Social Service Budget met, the recommendations out of this committee were to add 1.8 million, including 925,000 SGF for the summer EBT program for fiscal year 26. This includes $100,000 state general fund to replace any EBT benefits that were lost or stolen due to fraud. Additionally, the recommendation from this committee was to add language again to lapse any unspent money for the summer EBT program in fiscal year 26. This committee also added $883,200, including $380,748 state general fund for fiscal year 26 to purchase licenses for some software management. This committee also added $600,000 in one-time funding this is going to go to the vocational rehabilitation account. This is for Envision. There was also money added, $300,000 in one-time funding, TNF dollars, for community-based and school-based one-to-one mentoring for youth as age 6 to 25. And this committee also added $215,000 in one-time funding, vocational rehabilitation account for the Cerebral Palsy Research Foundation to administer the GILA program. And that is all I have for this committee, sir.
Okay, so I want to pause right there. Committee, if there's any thoughts or questions or discussion, that's just kind of wanting everybody to get used to the format. And if there are no questions, I believe, and thank you, Amanda, I do believe we need a motion to reopen the hearing on DCF to make a technical correction.
Mr. Chairman, I would move that we would open the Department of Children and Families budget, for 2025. And for this technical correction, which is to fully adopt the fall human services caseloads estimate for 2025.
Okay, I have a motion or recommendation. Do I have a second? Representative King? Any discussion? All in favor say aye. Any opposed? Okay, so, sure. Representative Ballard.
They take care of it.
Yeah. Okay.
And Mr. Chairman, I might state the amount. It's $997,737 state general fund.
Okay, so I had a motion, a recommendation passed. So I move that the Committee on Social Services budget recommend to the House Committee on Appropriations to adopt the appropriations for the Department of Children and Families as amended for FY25 and FY26. Do I have a second? Seconded by Representative Carpenter. All in favor say aye. All opposed? Okay. Passes. All right. That was DCF. Okay, next up is, going in order, KDHE. So Megan, you are up.
All right, I'll start on page number 2 of the committee report that you have in front of you. It shows that the agency submitted a revised estimate of $4.1 billion. That includes $971 million SGF for fiscal year 25. The LBC committee concurred with the agency's revised estimate for fiscal year 25 with the following adjustments. They deleted several reappropriations. This was for safety net clinics, local health departments, child care pilot, healthcare finance operations, laboratory equipment, administration program operations, pregnancy maintenance initiative, and SGF savings for the enhanced FMAP. They also deleted the agency's enhancement request, the supplemental request for health facility surveys for $2 million. They deleted the agency's supplemental request for Gainwell Technologies contract for $16.2 million, 4.8 SGF. They deleted $6 million, including $750,000 SGF for pre-admission screening and resident review for fiscal year 25. They deleted the agency's supplemental request for epidemiologist positions for $16,820 SGF, and they deleted 46.9 FTE positions across the agency. Oh, and finally, they also deleted $29.8 million. That includes $28.1 million SGF to adopt fall human services caseload estimates. Then, following the LBC, the House Committee on Social Services budget concurred with the LBC's recommendation with the following changes. They added back 30 FTE positions, those that are fully funded with federal funds for fiscal year 25. They added 9 million SGF for approved projects using the 10% FMAP federal match that was in fiscal year '25. Those were both reappropriations that were lapsed by the LBC's request. And then finally, they added 253,684 SGF for the Stanley Clark Pregnancy Maintenance Initiative, also reappropriated funds that were lapsed. And that's the entirety of fiscal year '25.
Okay, committee, any questions? Let's roll on to 26.
All right, fiscal year '26 is on page 4. The agency's request was $4 billion, and that includes 918.4 million SGF for fiscal year '26. The Legislative Budget Committee concurred with the agency's request with the following adjustments. They deleted an enhancement request for IT security upgrades. They deleted an enhancement request for health facility surveys. They deleted the enhancement request for infectious disease prevention activities and the Bureau of Disease Control and Prevention. They deleted the agency's request to upgrade current entry-level epidemiologist positions. They deleted the agency's enhancement request for and 5 FTE positions for the Bureau of Community Health Systems Public Health Program. They deleted 2.0 million, including 500,000 SGF, and that was for the electronic pre-admission screening and resident review program for fiscal year '26. They deleted 16.7 million, including 5 million SGF for the agency's contract with Gainwell Technologies. They deleted the agency's enhancement request for a Medicaid provider centralized credentialing module, and that was 12.9 million, including 1.5 million SGF. They deleted the agency's enhancement request for partial hospital services for behavioral health patients, and that was 1.5 million, including 564,000 SGF. They deleted 46.9 FTE positions across the agency. And finally, they added 108.8 million. That includes 56.1 million SGF to adopt the fall human services caseload estimates for fiscal year '26. Moving on to the committee social service budget recommendations. The Committee on Social Service Budget concurred with the LBC's recommendations for fiscal year '26, and they had the following adjustments. The first is to add 30 FTE positions that were funded entirely with federal funds for fiscal year '26. The second was to add 44.3 million, including 16.9 million SGF to increase Medicaid dental rates. They added 1.1 million, and that includes 420,000 SGF to raise the rate for the vagus nerve stimulation implants and reimplants. They added 263,000 to support services provided by the Cerebral Palsy Research Foundation in Wichita. They added 215,000, including 82,000 SGF, to add language requiring that state Medicaid program provide reimbursement for diagnostic evaluations and annual preventative maintenance, and add language to eliminate any requirement of prior authorization for evaluations and annual maintenance for complex wheelchairs. They also added language to eliminate the requirement for prior authorization for complex need wheelchairs as long as the individual received a prescription in the specialized wheelchair clinic. The committee added 1.9 million, including 742,000 SGF, to increase the rate for the dentist code. That is for the reimbursement of facility fees that are accrued when providing services with monitored anesthesia. They transferred 8.7 million, and that's from the HCAP fund to the state general fund. This is interest that was accumulated by the SGF credit that is given to the HCAP fund for cash flow purposes. They added 10 million for hospitals providing inpatient behavioral health services for adults, with language on how to distribute those funds. They added 2.7 million, including 1 million SGF to increase Medicaid reimbursement rates for pediatric visits. Number 11 on page 6, the committee added 632,000, including 242,000 SGF, and language instructing the agency to implement CPT for cognitive assessment and care planning for individuals with Alzheimer's. in the state Medicaid program. They added 55,000 SGF for the donated dental services program. They added 550,000 SGF for Project Access, Health Access, and WIJO Care. They added language that directs the agency to raise the protected income level for the medically needy population to 100% of the Social Security income, and that is to be funded through existing resources. They added language that the interest earnings attributable to the SGF credit received to the HCAP fund will be transferred from the HCAP fund to the SGF in fiscal year 25, or I'm sorry, in fiscal year 26. That's the interest that's accrued in fiscal year 25. They also added language to limit the credit to not include interest in future years. And finally, they added language that would require the critical access hospitals and rural emergency hospitals to be included in the provider assessment for the healthcare access improvement program.
That is a bunch. Thank you, Megan. Committee, any questions as you kind of go back over this? It's a lot of work. So what is, if I may, Megan, on number 8, the transfer $8.7 million in interest from the Healthcare Access Improvement Program, is that different from, I thought there was something on page 2, maybe it. Representative Carpenter.
Mr. Chairman, that's $8.7 million of interest that's been sitting in the HCAP account. We used that to offset the $10 million for the hospital mental health beds. So we actually took that money. And
Okay.
added,
My memory was fuzzy on that one. Okay. Representative Rivas and then Representative Carpenter. Go ahead, Representative Carpenter.
So there was some discussion the other day about the $55,000 donated dental services, whether there was $70,000 in the budget. Did we ever find out? So there is $70,000 in the budget now, and this just makes it $125,000.
Representative, I spoke with the advocacy group following that meeting, and they did say that they had confirmed that that was in the budget.
Okay, very good.
Representative Carpenter.
So, Megan, what I would like to see is the total from number 3 down to the end, which the last 3 are very little, down to 12, the actual total of that amount of addition, and then conversely, I'd like to see the amount of LBC deletions in the budget on page 4, which come clear down 1 through 7. Because 11 is a caseloads deal, I want to skip that probably, but stopping at 9 to see what that amount there would be. If you could get that for the committee, just it's a comparison of what LBC cut out and then what we put back in. I think you'll.
1 through 9 on pages 4 and 5.
9 on 4 and 5, and then
3 through 11.
3 through 11.
On 5 and 6.
If you could get that to the committee. Very good. Thank you.
Okay. Representative Rivas.
I've got a couple of things. One on number 8 and number 9. Would it be helpful if the 8.7 million was referenced in number 9 and to help the committee understand tomorrow? We got it from Representative Carpenter, but it might be handy to throw a line of explanation in there, just as an observation. That's at your discretion.
Yeah, either that or I will. I'm making a note around that myself right now. And I know I have Phone a Friend 1 and Phone a Friend 2 for tomorrow and Friday.
And I have another one.
Okay, Representative Rivas.
So if you look at number 13 and that second sentence where the statement in the second sentence, I would like that same sentence in item number 12 regarding donated dental, just change it to statewide. because that money is to coordinate those services. It reads like it provides the charitable, the actual dental work. You follow?
So your point is for presentation purposes for 12 and 13, those are actually statewide?
Yeah, for number 12, it is statewide. The other was by certain counties, but I'm just saying, so the donated dental is, it should say this program coordinates donated dental care for low-income uninsured residents, also statewide. Something to that effect. If you just want to communicate that, that's fine.
Okay. I'm making that note.
Thank you.
Committee, any other questions or thoughts as you're perusing this? I know it's a lot to throw at you. That is the process we're kind of working with right now. Any other thoughts or questions on KDHE? Okay, with that, let's roll over to KDADS. And Dayton, you're up on this one. And while he's getting ready, I guess we don't have to go through Office of Veteran Services unless, okay, we're good. Got it. Okay, Dayton.
Okay. I'll start on page 2 as well. I won't walk through the whole agency description that you can see there. The two biggest reasons for the decrease below the approved are the agency lapsing a large amount of their reappropriations, as well as a decrease associated with the 24/7 pay plan transfer as those are shifted to the state hospitals. Are also FTE additions, 13 FTE positions that were funded by last year's legislature, but the FTE position count was not increased, as well as 10 temporary federally funded FTE positions to administer the 10% FMAP projects. The Legislative Budget Committee concurs with the revised estimate in 25 with a number of adjustments. First, delete $45 million in reappropriations for the HCBS 10% FMAP savings. Item 2, delete $3.7 million state general fund to remove the reappropriation for electronic health record startup project, KMA study, and PASSER funding. Item 3, delete $1 million for the Nutrition Services Incentive Program grants to offset a decrease in federal funding and to reduce wait lists. Item 4, delete the 11 temporary FTE positions. Item 5, add $131 million, including $2.4 million state general fund to adopt the fall caseloads estimate. The Budget Committee concurred with those deletions, or those changes, I should say, with the following two adjustments. First, to add back the $45.1 million from the State General Fund to restore the lapsed reappropriation. And item 2, to add $140,000 State General Fund to provide in-home services to low-income and older individuals. And that item was nursing homes without walls. And I would note, yesterday the items were not marked as one-time or ongoing largely, so I kind of used my best guess, so I'm glad that you all are here to verify whether I'm right in my guess. So that item I had marked as one-time. And that's all for 25.
Representative Rivas?
Yeah, thank you, Chair. I just want to verify the 45.1 million, it says SGF. And I may be mistaken, is that the money that was actually federal funds that we're rolling over?
Dayton, you want to?
Mr. Chair, Representative, you're remembering, that is the item that you are remembering. They were state general fund savings, though, due to an increase in federal funds. So this is the SGF savings that must be used for those projects.
Still required to use it.
Right, that's right. Yep.
Representative Carpenter?
And I think the important part is that we'll do our best to explain is that this is federal money. It was federal money, but it's now SGF, but if we don't use it and the intended consequences, we will have to return it to the federal government.
Okay, any other questions on FY25? Did you have a question, Representative Oropeza? Okay, you good? All right. Dayton, FY26.
All right, turning to the next page, page 3. The all funds increase is attributable in the agency request mostly to the 14 enhancement requests totaling $91 million, including $62 million from the State General Fund. as well as increases in federal funds. However, that's offset by the deletion of a number of one-time projects that only occurred in fiscal year '25. Additionally, 2026 does not include the 11 temporary FTE positions that are included in the '26 requests. The Legislative Budget Committee concurred with the revised estimate and deleted a number of enhancements. First, delete 45 million state general fund for grants to HCBS providers to become compliant with federal rules. Item 2, delete 13.3 million, including 5.1 million from the state general fund to not increase the number of individuals served on the HCBS for elderly waiver. Item 3, delete 4 million SGF to not continue the contract with Public Consulting Group to develop the community support waiver and other IDD projects. Item 4, delete 8.1 million, including 3.1 million from the state general fund to not increase the number of individuals served on the HCBS TA waiver. Item 5, delete 5.4 million, including 2.1 million state general fund to not increase the number of individuals served on the HCBS brain injury waiver. Item 6, delete 1 million for the Nutrition Services Incentive Program grants that would have offset a decrease in federal funding. And turning to the next page. Item 7, delete 2.5 million, including almost $1 million SGF to not fund a partial year's implementation of the community support waiver for '26. Item 8, delete 500,000 to not continue funding contract positions and services to implement the Olmstead settlement requirements to connect individuals discharged from nursing facilities for mental health with services upon discharge. Item 9, delete 102,000 to not create an aging services manager position. Item 10, delete 180,000, including 90,000 state general fund to not continue funding existing positions providing oversight of the PACE program of PACE. Item 11, delete 3.5 million from the state institutions building fund to not fund the priority 2 rehab and repair projects at the state hospitals. Item 12, delete 4.7 million SIBF to not remodel the A building at Adair Acute Care on the Osawatomie campus. Item 13, delete 2 million SIBF to not remodel the Cottonwood Resource Center building on Osawatomie campus. Item 14, delete 926,000 SIBF to not remodel the Special Services and Myco House facilities on Osawatomie campus. And finally, add 319 million, including 87 million from the State General Fund to adopt the fall Human Services caseload estimate. The Budget Committee can.
I do have one question, if I may.
Sure.
So when I see add on the LBC, when it says add 319 million, including 87 in SGF for the fall Human Services caseload estimate, pardon me. Is that number not included in the agency numbers that are given? I'm guessing. I mean, it says add, so.
Mr. Chair, those are not included because the agency submits their budget in August, September, and the consensus group meets for fall caseloads in November. So that estimate was not available at the time the agency
That
submitted
is
their
ringing a
budget.
bell now. My apologies for just being slow on the uptake. Okay.
Would you like me to continue?
Yeah, continue, please. I'm
Okay.
sorry.
The Social Services Budget Committee made the following adjustments: add 75.5 million, including 29.3 million state general fund for an add-on payment to nursing facilities at $20 per day based on the number of Medicaid residents. I'd marked that as a one-time expenditure because in past years it had been marked as one-time. Item 2, add $35 million, including 13.6 million from the state general fund to add 500 individuals from the wait list to the IDD waiver. Item 3, add 8 million SGF for grants to community health, mental health centers for fiscal year '26. I'd marked this item as one time. Grants have been marked as one time in the past. And please, if there's disagreement, I can adjust it. Item 4, add 12.4 million, including 4.8 million state general fund to fully rebase nursing facility reimbursement rates for '26. Item 5, add 1.8 million state general fund for workforce development for substance use disorder providers for '26. I'd marked this as one time. Item 6, add 4.2 million, including 1.7 million from the state general fund to increase the specialized medical care rate from $50 to $55 per hour for the TA and IDD waivers. Item 7, add 1.6 million from the state general fund for problematic sexual behavior cognitive behavioral therapy program for the items listed there. I'd marked that as one time. Item 8, add 3.9 million, including 1.5 million state general fund for a behavioral health add-on payment of $175 per Medicaid day for nursing facilities for a pilot program capped at 125 participants. I'd mark that as one time, similar to the Medicaid add-on above. Item 9, add 1 million to offset a federal cut to senior nutrition. I'd marked that as one time. Item 10, add 2.5 million, including 1 million state general fund to implement the community support waiver for a partial year with 500 participants. Item 11, add 830,000 for one-time funding to renovate a homeless shelter. Item 12, add 600,000 for respite care for caregivers of individuals with Alzheimer's. I'd marked that as one time because it was one time last year as well. Item 13, add 540,000 state general fund to provide in-home services to low-income older individuals. I'd marked that as one time. Item 14, add 350,000 for a second-year grant to continue to expand core communities. I'd marked that as one time. I believe that was one time last year in the DCF budget. Item 15, add 250,000 to provide aftercare services for individuals discharged from a psychiatric residential treatment facility. Again, that was marked as one time last year. Item 16, add language to rebase rates for the program for the all-inclusive care of the elderly at 90% of the amount that otherwise would have been paid. I'd marked that as one time. Item 17, add language to increase the lottery vending machine transfer cap to 12 million at a rate of $1 million per month for 26. Again, this has historically been done each year as a one-time item. Item 18, add 2 million SGF and delete 2 million SGF from the mental health intervention team program for telehealth services for students. I'd marked this as one time. And finally, add language to cap the waitlist for the IDD waiver at 4,000 and the PD waiver at 1,800. And that was marked as one time, same as last year.
All right, Dayton, thank you very much. Okay, committee, that was a lot to unpack. Any questions, discussion?
Yeah.
Representative King?
Yeah, I have a question. Thank you, Mr. Chair. I have a question on 17, the increase the lottery vending machine. Can this committee make recommendations or changes to the amount that we receive?
Mr. Chair, this is something that's been done through this committee for the past number of years. It's a lottery vending machine transfer that actually goes to KDADS, and any amount over the cap, which in statute is set at 8 million, any amount would go to the state general fund. And the committee has historically increased it each year. So it has been done, if that answers your question.
All right. Thank you, Mr. Chair.
Okay, Representative Carpenter?
Thank you, Mr. Chair. I would like to take a look at, it's the one that's $8 million of mental health. It's number 3. And I would humbly beg the committee's permission to change that up a little bit and change it to $6 million for mental health and then $2 million for the funding addiction psychiatry and child adolescent psychiatry fellowships, nursing programs, educational pathways for the Kansas Behavioral Health Center of Excellence.
Jill, do we need a motion to reopen? Okay, I'm going to make a motion to reopen the KDAD's budget. So I need a second. Representative Reese seconds. All in favor? Any opposed? Okay, we are open for business. Okay, Representative Carpenter.
Yeah, basically, it's taking $2 million of that to fund the Behavioral Health Center of Excellence that was started last year that deals with nursing. It deals with everybody and scholarship programs and all that kind of stuff. So, and the other $6 million would be to pay for uninsured folks in our mental health systems.
Okay, committee, any discussion? Representative Rivas?
So was the funding 8 million the year before for community mental health centers, or is that an increase?
Somebody else. I've slept
Dayton?
since then, so somebody else is going to have to.
To me,
That's a question for Dayton.
Mr. Chair, Representative, that is an increase over the amount that they that they typically receive. I believe it's between 50 and 60 million. I read that at the last meeting, but I can't recall the exact amount. And
It's an $8 million increase.
that's correct.
Okay, so, okay, I'm okay with it, because I know there, a lot of them have contacted me, and I'm okay with that at 6, as long as it's still an increase.
Okay, so committee, we have a Representative Ballard.
They're getting the same amount.
Plus.
But instead of coming from SGF, we're splitting between two accounts, right?
No, the recipients of the 8 million, that's an increase, the recipients, the $8 million increase is divided up as Representative Carpenter had indicated. That's the way I interpret it.
It's it is FGF though.
Yes, it's SGF, so it's two accounts, and then it becomes from the one that we funded last year, Wichita, the heavy one, so 2 from that account, and then 6 from SGF to fund the 8.
Okay, everybody clear? Okay, so that was made in the form of a recommendation. Do I have a second? I get Representative Reese, I saw her first. Any discussion? All those in favor say aye. Okay, recommendation passes. Okay, so that was one. Representative Carpenter.
I have one more cleanup item here, and it would be it's in the form of a budget proviso. If folks that were around last year remember that the CDDOs get a percentage to take care of the new folks on the ID and DD wait list. For administration for that, we had quite a deal last year and ended up doing it. But this proviso would say during the fiscal year ending June 30th, 2026, 2.4% of the funds appropriated by the legislature for the purpose of taking persons off the ID and DD wait list will be provided to community development disability organizations for the purpose of covering the costs associated with bringing those persons into service via HCBS ID and DD waiver or the community support waiver. I assume it'd be 20. That's my motion. It's just a percentage, 2.4%. And if I'm not mistaken, that was in the budget last year, was it not, Dayton? The language wasn't added last year? Okay.
Yes, Mr. Chair, Representative, last year, language was not added based on a percent. A dollar amount was added to the omnibus bill based on what the CDDOs projected that they needed for the additional administration.
Thank you, Dayton. Okay, so that's the recommendation. Do I have a second? Okay, Representative Reese. Any further discussion? Representative Steens.
Thank you, Mr. Chair. So I had a question on the line item 5 under the House Committee on Social Services. The 1.8 million SGF for workforce development, is that for MERE?
It was Mayor.
Okay,
Yep.
thank you. Thank you for that clarification.
Number 5.
It was in.
Okay. Confirmed. All right. Okay. Any other questions, clarifications? Okay, so then I'm going to make a motion that the Committee on Social Services budget recommend to the House Committee on Appropriations to adopt the appropriations of Kansas Department of Aging and Disability Services as amended for FY25 and FY26, as provided in House Bill 2007. Do I have a second? A second from Representative Oropeza. All those in favor, say aye. Any opposed? Okay, motion passes. Okay, that is all the business that I have today. Oh, we do. Dang, all right. Oh, so you want to go through the fourth one? Okay, we roll on. Okay. We're going to roll to Kansas Office of Veteran Services. There may not be much change here. This is the one that Molly does, and she's not here today. So let's just take a look at what we have for tomorrow. No changes. If there is such a thing as an easy thing, which is probably never good to say, for FY25, between agency, the Legislative Budget Committee, and our committee, we are all locked on at 56 million and some change. I don't see any change, no. State institution building fund monies. Okay, and then as I roll into FY26 on this one, I believe it's the same story. So of the four in the next 2 days, this one will be the easy one. No, Veteran Services. So any questions on Veteran Services? Wait till next year. Yeah. Okay, so so that's all the business that I have today. Before we adjourn, committee, anything else? Okay, the lineup for appropriations tomorrow, this is what we can expect. Committee meets at 9. We will probably go, I have no idea how many agencies behind. Megan will just probably look at me and say a lot. We're going to start at 9. We will go to session at 11. Whenever that gets done, after whenever appropriations will meet again. I think tomorrow appropriations needs to be done by 1:30. So we will go, and the 3 that I have for tomorrow, I think are the last. I think I'm at the tail end for tomorrow, which is not promising. It could be they're all done on Friday. So the committee will meet again on Friday at 9, and what Chairman Waymaster said is we will go till we're done on Friday. So that's the lineup for the next 2 days. No. Not unless you want to come back and have fun. No, I don't anticipate there being any more social service budget meetings this week. We do have the schedules out for next week. I think there is a bill hearing as it stands today. That could change. But that's it. So if there's no further questions, we are adjourned, folks. Thanks.